Hi, this is Ian Wright, and I just wanted to do a little bit of a podcast on childbirth choices. I was actually researching something completely different. I was working on a chapter on a book on anxiety I'm writing, which was about social connection, and I came across a piece of research which made me think about childbirth and the choices that we make and the choices we're given in childbirth. It's an area that I spend a lot of time with because I treat babies who've had difficult deliveries, who are colicky, sleepless, irritable, shocked, traumatized. But the one side of it that isn't mentioned enough is the mothers that are somewhat left traumatized after a difficult assisted delivery. Up to a third and up to 5% can actually have post-traumatic stress disorder. So it can be traumatic, and it just got me thinking about what we can do and what is trying always to be done to minimize that kind of trauma, because the first thing that we have to talk about this is safety. Safety is key and absolutely optimum. The child has to be born well and okay, and that is the key subject. But what tends and has tended to happen because of litigation, lawsuits, most obstetricians will be sued 2 or 3 times within their careers. That's normal. That their insurance is huge, so they tend to go for safety first, a little bit possibly too much, from my understanding of it and talking to people. And I was just looking at some research where they said sort of an ideal rate within the population of a C-section rate of between 5 and 10% is optimum for the health of babies and mothers. And below that is dangerous because there can be too many traumatic deliveries, and that happens obviously in the developing world. But that isn't the rate that we have, So in the USA, it's about 33%. In the UK, Ireland, it's 28% of C-sections, and it's still going up. So why? What's going on here? And I'm just going to talk about a couple of elements which are interesting about and just the research I was just looking at just now. One of the most successful things that people can have that can minimize assisted delivery, meaning using forceps or suction ventouse, or strong pain relief, can be, and this is research based. There was a piece of research actually that was taken in 2012. I think it was taken called Hodart, did the research. It was about 16 countries. They actually did this research in about 15,000 mothers. And it showed that if there was one-on-one support of mother by a midwife or a doula, who is a kind of a person who can come in and be primarily the support to the mother, talk them through it, keep them in the breathing techniques, keep their rhythm. The whole point about childbirth is rhythm. And if the body can stay in a rhythm and can build the contractions slowly, and the process of the childbirth stays rhythmic, cool and calm as much as it can be, then there is the minimal chance of traumatic assisted C-sections, babies getting stuck. These are really kind of important things. So the research shows if you have someone constantly with you, there's much less chance of a difficult or traumatic delivery. Number one, that's very key. Now, the health services are stretched. There aren't enough midwives. It's incredibly hard to do so. But maybe thinking about having a doula or a person who is assigned to you, who understands the process of childbirth, a woman often, or maybe a husband as well, who can do this, who keeps you in rhythm. where you feel safe. The important thing is when the pain gets extreme and things feel different, especially in a first delivery, and you don't understand the process, you can have your birth plan as much as you like and everything is set out perfectly, but it all goes out the window when things start hotting up. And you need someone to keep you calm. And midwives are brilliant at this. I mean, midwife, and obviously, again, the research is very clear. Midwife-assisted deliveries have far less chance of instrumental C-section results, of course, because they stay there. They keep the rhythm. The doctor should be there if there's a problem, in an ideal world. And it should be the midwives, because they're far more experienced almost in this, in the processes, in the rhythm of it. A couple of other things, when you bring on the contractions using, say, oxytocin or other derivatives, this strengthens the contractions. You get strong, rapid, hard contractions when the baby may not be ready. And there is clear evidence, obviously, of more chance of distress and assisted deliveries. How many times does a mother come in to me say, well, the obstetrician came in and, gave me some oxytocin, contractions went well, I lost control, took an epidural, you lose kind of control of the rhythm and you can't feel it so well. And then obviously the baby gets in distress, the mother is slightly in distress, and an assisted delivery happens, or they go to an emergency C-section. So ideally, things like that should be left, and there should be a natural. Now, obviously, there is safety. Safety is first, but within reason, we need to find balance, don't we, when we're doing this? Another one, which I find crazy as an osteopath, is delivering a baby when you're lying on your back. Now, when you lie on your back with your legs in the air, it just locks up your sacrum, which is a very important, but it's the bone at the base of the spine, okay? Which needs to move. What happens is when the baby's head comes down into the pelvic brim, the sacrum moves backwards, and then when it goes down into the outlet, when it's coming out, the sacrum moves the opposite way to move the coccyx out of the way. So this sacrum, it's the one time where the sacrum has to move within its ligaments. Now, if you're lying on it, it can't do it as much. So every baby's going to get stuck. This is basics. So kneeling up, standing, just not on your back. Side is even better, but not on your back. I think that's a really important one, and it's just not normal practice, and it should be. And rhythm. In some of those, the kind of research establishments, when birth was done in a much more natural way, and the lights are low, rhythm is kept, the conversation is quiet, it's a warm environment, all these kind of gentle things in the background keeps mother in rhythm. And it's very the opposite from the kind of cold and sterile environments where it's very hard to keep that rhythm. But the number one thing is to have support, so have someone there who can continually keep you in rhythm and keep you back to your birth plan, where you're going, I don't think I can do this, it's too much pain. And they say, well, hang on, shall we really let's see how we can stay with this, and can you really push on through, breathe on through it, come through that contraction, okay, let's keep moving, that kind of thing. I mean, this is just a brief thought. This is a massive subject, and we can talk about this forever. But I'm talking about it with regards to someone who spends a lot of time with babies who are shocked a little bit, or mothers who are shocked. And it's very important, actually, to treat mothers who have shock and trauma postpartum, because they are the nurturer and care of mother. So actually, if mum is shocked, how can baby be calm? So we need, sometimes, actually incredibly often, you have a baby who's really traumatic and has had a lot of shock and is crying and irritable and sleepless. But actually, often I have to treat mum first, because actually, if mum's not right, how can baby be right? They live in the same field. So it's very important for me to always check mothers after birth. So actually, baby and mother checks are the way forwards, actually. And we've been doing those for years. Anyway, I wish you well.